The final medical area I'm going to lecture on is the acute abdomen. Now, what is the acute abdomen? Acute just means it's happening right now versus chronic, which is a long-term condition. And the abdomen, obviously, that's the abdomen. So we're going to talk about a few of the medical conditions that you might encounter when it comes to abdominal problems. As I mentioned earlier, we want to hope that this is a problem we can manage because the abdomen is very difficult to manage in a backcountry setting. So what are the areas that we can manage when it comes to the acute abdomen? That's nausea, vomiting, diarrhea, and constipation. Now, it doesn't sound pleasant, but we hope it's one of those. Now, is someone going to get nauseous, possibly vomit, get diarrhea or constipated in a backcountry setting? Absolutely. It happens all the time. You're going out on a trip, you're spending time in the woods, you're eating food that you're not used to, maybe you're in a foreign country, and it's not like we're sitting around eating fresh fruits and vegetables. We're eating dehydrated meals, you're eating pepperoni and cheese. These type of problems are going to occur. What do we need to know about them? Well, in reality, nausea, vomiting, diarrhea, and constipation usually are self-correcting problems. We have to do very little to actually treat them. We simply manage the patient. We can help things along. One of the things to be careful of is being aggressive when it comes to nausea, vomiting, diarrhea, and constipation when it's not called for. Let's start with nausea and vomiting. Well, nausea is just feeling upset. You have an upset stomach, and it can happen for any type of reason. If you've ever had an upset stomach, you know exactly what I'm talking about. What can we do for this? Well, bland foods can help. That's not always an option in the backcountry. Staying hydrated, that's a good thing to do. And you can use some sort of nausea medication, something like a Pepto or a Tums if it's an acid problem, any of those types of things. You also have things available to you that would be a prescription, something like Zofran. That's an anti-nausea medication. That can help. But as I said, that's a prescription. When it comes to vomiting, vomiting is happening for a reason. You have to understand, why is your body vomiting? You're trying to rid yourself of whatever that foreign contaminant is inside your stomach. What that means is, I don't want to stop vomiting. You want to actually allow this to occur. Is this always pleasant? No. We want to stop vomiting, especially if we're on a holiday, we're on a trip somewhere. We don't want to be spending our entire time vomiting. But if you give patients who are vomiting something to stop that when it's not indicated, you're actually keeping that foreign contaminant inside their body longer, which is going to make it worse. When we start to think about giving someone an antiemetic, something that's going to stop them from vomiting, again like a Zofran, is when it becomes intractable, meaning they can't get past it. They cannot keep anything down. It's been 24, 36 hours where they're vomiting. They're getting weak. They're showing other signs. Then we want to think about treating them, and if we can't, evacuating. Now again, you may want to leave the woods anyway before that because vomiting in the backcountry is never a fun thing. Let's move to the other side, constipation and diarrhea. Constipation, again, is a very common thing. We want to stay away from any outside treatments. If I have constipation, I might think about giving someone a suppository. But if I give them a suppository and it's not indicated, now I end up with the opposite side, diarrhea. So we want to think about trying to keep them hydrated. Make them drink lots of fluids. They're constipated because they're pulling too much fluid out of their stool. High fiber things. Again, if I have access to fruits and vegetables, that would be good. That's what we're going to try. If it doesn't resolve or the pain becomes too great, again, we can evacuate. Diarrhea. Diarrhea is extremely common. Anytime you travel, anytime you're in the backcountry, it's probably bound to happen to you. Diarrhea is an extremely uncomfortable and unpleasant experience for anyone, and no one wants it to ruin their trip. However, just like vomiting, we don't want to treat it unless it becomes intractable. The treatment for pretty much all diarrhea that you're going to ever experience is let it run its course. Now, I know that doesn't sound like the most enjoyable thing, but that's what you need to do. What is diarrhea trying to do? You're trying to flush that out of your system. You're trying to get rid of that contaminant. If I give you something that stops all bowel movements, I'm just keeping it there longer. The other problem is if I start treating diarrhea with antibiotics. This has become a big problem all around the world. There are large areas of the world right now where primary antibiotic treatment for diarrhea, such as traveler's diarrhea, no longer work because the treatment with antibiotics was not indicated, and then the dosing in the regimen was not taken appropriately. In fact, Nepal as a country can no longer use the primary method antibiotic because of mostly foreigners traveling in and taking these antibiotics and creating superbugs. Yes, it seems unpleasant. Yes, it seems uncomfortable for you to have diarrhea, but the treatment is to let it run its course. Most diarrhea will self-correct in 3 to 5 days. You really want to stay away from antidiarrheals. They're not the best treatment. Stay hydrated because diarrhea causes you to lose a lot of fluids. Eat and do the best you can. If any of these things progress, become worse, make the patient change mental status, or they don't get better, then yes, we want to think about further treatments and we want to get out of the woods. We hope, though, that abdominal problems when it relates to medicine are nausea, vomiting, and diarrhea, because if they're not, there's not a lot that we can do for it. So what are the other big concerns that we might have when it comes to medical abdominal problems? Well, it's appendicitis. Appendicitis is very common, and it's something you might encounter because no one can expect appendicitis. You don't plan on getting appendicitis. It can just happen. How does appendicitis present? Well, what's going on is that your appendix is sitting at the end of your intestines, right off the side, and something floats along, and a piece of that goes into the appendix, and it gets stuck there. And basically what happens is because there's no movement, it starts to rot. And as it rots, it causes infection, the appendix swells, and that's the pain that you're feeling. So what are the signs and symptoms? Well, originally what will happen is that appendicitis presents as what's called peri-umbilical pain, meaning it's pain right around the belly button. If you ask good histories with someone that you suspect is having appendicitis, and you say, when this first started, where was it? Was it always in one spot or did it move? They might tell you that it started around their abdomen, right here in their belly button, and then it moves down to the lower right. Appendicitis classic presentation is pain down here in the lower right quadrant. Other tests that you can do is what's called the rebound tenderness test, meaning the patient is sitting there and they're in pain. If I push on the spot where the pain is, it will feel better. If I let go really quickly, they're going to get an excruciatingly sharp pain. That is a classic sign of appendicitis. Not diagnostic, as I'm 100% certain, but it's the best I can do in the woods. Another test that you can try is if they're laying down, you can hit the bottom of their right foot. Give it a good slap with a straight leg. What it will do is cause pain because you're sending a wave up their leg and it hits that inflamed appendix and it will cause that pain. All of those point to appendicitis. You're also going to have things like nausea and vomiting. The patient's not going to want to eat. You're going to find them usually in a fetal position, those types of things. It's very easy to mistake appendicitis for simply constipation or a stomach bug. So run through your tests. Now, if you suspect appendicitis, this is an evacuation because this can turn into a real critical life-threatening emergency very quickly. You need to get them out, however that is. If your patient has all the signs and symptoms of appendicitis and all of a sudden they go, oh, the pain's gone, or over a period of time, the pain disappears completely and they say, yeah, I feel a little bit better, get out faster. Because probably what's happened is they burst their appendix. And the reason why the pain went away is because now there's no inflammation. And so the pain is gone. The problem is your appendix, which contained that rotting material, has now exploded inside your abdomen. You're going to get septic or full body infection very rapidly. So suspected appendicitis, you need to move out. This is a surgical concern. I mentioned earlier that there was one question we need to think about asking when it comes to abdominal problems, and I told you to be thinking about it. Well, here's the question. We need to ask women complaining of abdominal pain if there is a possibility they could be pregnant. Don't ask if they are pregnant, ask if there's a possibility they could be pregnant. Because what I need to rule out is whether or not they have what's called an ectopic pregnancy. While not hugely common and not something you may encounter, it is something you need to be concerned with. An ectopic pregnancy is when an egg implants outside the uterus. It can implant in the fallopian tube, or it can actually implant in the abdomen itself. If a female patient presents with vague abdominal pain that you can't ascribe to something else, and they say there's a possibility they could be pregnant, you need to evacuate immediately. An ectopic pregnancy is a life-threatening emergency. Make sure you take it seriously. Other than that, there are a lot of other medical problems that occur in the abdomen, but they're rarer and they're not things that you're going to be able to diagnose or necessarily treat. If you think something's going on with the abdomen, be it trauma or in this case medical, try your best to sort it out. Hope that it's nausea, vomiting, and diarrhea, but if not, or you're not sure, think about heading to the front country.